Before I get started, I wanted to take a few minutes to recognize and thank a few groups in the room here. Number one, the Canadian Pain Coalition, first of all, for organizing this public symposium, inviting me to be able to talk to you good folks and have another chance to help people with chronic pain. Second group I'd like to thank is, of course, all of the pain consumer groups that have been so kind to show up today and sit up in the hall. They have a very important thing to bring to us, of course, in chronic pain, and their support is very much appreciated. Finally, and perhaps most important, is I'd like to thank the registrants that came today. I understand that there's a total of 200 people registered today, and that type of turnout means a lot of power in what's being brought to the room and how that can be taken out of the room. I'd invite all of you folks, besides taking what you need to learn for yourself or for your loved ones that you're here for about your own chronic pain, also share this type of information as well with other people that you know that suffer the same type of thing. Thank you for all three of those groups. As mentioned, I'm a pharmacist, and I wanted to give you a bit of background about myself. That way you'll know where I'm coming from in this conversation. I've been practicing pharmacy in the community for roughly 20 years now altogether. And I've been interested I've had a special interest in chronic pain, I guess, for about a half dozen of those years, roughly. I currently work for the Calgary West Central Primary Care Network, and I know that's a bit of a mouthful. We made it through, though. I'm not sure if anyone here is familiar with what primary care networks are. These are a healthcare organization that's unique to Alberta, and they help family physicians achieve the healthcare goals of their patients. One of the ways that the primary care networks operate is by creating collaborative care teams that work with family physicians right where the patients are seen, right in their offices. Currently, I work with one such of those teams, made up of a family physician, a consultant nurse, and myself as the clinical pharmacist. From having worked with one of these collaborative care teams, I can honestly say that the impact of the team is greater than the sum of the impact of each of its members. You'll hear me talk today about these pain care teams and the involvement of pharmacists because I am a believer in this team care model, and hopefully you can get something out of that. Let me take a moment to speak about the role of the pharmacist. I don't think that there's probably anyone here that hasn't dealt with a pharmacist before. Many people describe that they see their pharmacist at their pharmacy several times a year, making that pharmacist one of the most easily accessible points of healthcare available to them. Beyond the idea of ease of accessing a pharmacist, they're also a knowledgeable and very trusted source of health information and have been helping Canadians make healthcare decisions for a long time. I think everyone recognizes that pharmacists are supplying their medications. They're the people putting the prescriptions together, getting your medications ready and dispensing them. But they also work really hard to assess your medication and make sure that they're appropriate in light of the uniqueness of each patient that might be needing these medications. That way, each medication that we prepare and give to folks has the best chance of being well tolerated, the most safe, and maybe the most effective medication that they could take, especially in the face of the other patient factors, such as your other medical conditions, the other medications you take on a regular basis, and the lifestyle that we know you lead while you're not treating your pain. Pharmacists call this treatment optimization, and that's one of the things that pharmacists bring to you. In Alberta, pharmacists are also trying to create more opportunities to do medication treatment optimization for you. There's three main actions that have to be in place for this to occur. A couple of them are already completed. You might recognize them, and you may not recognize them. And there's one more that needs to occur as well. First of all, the first action is that pharmacists have been involved in training and certifying pharmacy technicians in Alberta to take a larger and larger role in preparation of your prescription medications. The reason that's really important is because traditionally that's been a role of the pharmacists in Alberta. And it is one of those things that compete for the pharmacist's time, where they may be preferring to help you treat your conditions, treat your pain, for instance. Being able to have trained and skilled people that can share in the role of preparing your medications means that we will then have more time in helping you. Second action that's important, that's just occurred in Alberta as well recently, is that the pharmacists in Alberta have been granted prescribing authorization by the government of Alberta. This is in recognition of the expertise that pharmacists bring in medication therapy. It also is recognition of the value of the pharmacist in assisting the physicians, specifically the family physicians, in helping treat their patients too. The third action is the one that hasn't been completed yet. Pharmacists in Alberta are working hard with Alberta Health to create changes in funding of health services for Albertans. We want to ensure that the pharmacist service are well supported in the community for you. I'd encourage that each person who is living with chronic pain work very closely with their pharmacist to create a truly effective pain care team. Now, I know that that maybe help recognize who your pharmacists are, but let's talk about what pharmacists do. Pharmacists provide a whole variety of services and resources to their patients. Number one, as I spoke to before, where accessible is the first point of care. Not uncommon for people to visit their pharmacists when they first have some episode, maybe their chronic pain, and look for what might be the cause. Pharmacists can sometimes help identify those causes of what's troubling you. Sometimes they can help you find ways to try to eliminate those causes or the things that might aggravate those causes. And finally, they can help you identify if there's non-prescription treatments that might be important for you to consider or access. Not only non-prescription, but also non-medication as well. We can help you understand the role that medications might have to play in treatment of any condition that you bring to us. And that includes identifying the risks and the benefits of using a medication treatment, but more importantly too, sometimes the risks of not treating a condition that you have, sometimes like chronic pain. It's not uncommon that we might help you select an over-the-counter medication for many of the self-limiting conditions that you have, or guide you to instead to the right type of care when further assessment might be necessary. If you do require further assessment by a physician, sometimes we can help them select the right medication for you based upon what we know about you already too. When pharmacists get involved in selecting and providing medication therapy, a lot's going to be considered to make that decision most appropriate for you. There's 6 points specifically that every pharmacist should be looking at as they help assess what medication might be best benefit for you. Number one, pharmacists going to need to learn a lot about what's affecting you so that we understand what type of medication choices might be effective for that particular condition. Second of all, we need to collect a good medical history so that we understand that medication chosen doesn't negatively affect some other medical condition that you currently have as well. Third, we need to identify any previous medication allergies that you might have experienced in the past. It's not uncommon that a medication that might be related to an existing medication that you've had an allergy to, it could be chosen if we're not aware of that, for instance. Next, the pharmacist wants to learn if you've had any type of intolerances to medication treatments in the past. The reason that's so critical is because it's not uncommon that we'll understand another medication choice that we could make might create the same type of intolerance that you've recognized, and it allows us to sidestep that type of treatment. We also want to have a good, solid, thorough list of current medications so that we can understand if the medication chosen is going to have an interaction which might create a negative experience with any of your existing medications. Finally, we need to understand what your lifestyle looks like to ensure that the medication chosen will support those things that you want to do in life, such as work, going to school, parenting your kids, the recreational activities we have, and relaxation as well. Once a medication therapy has been chosen based upon a lot of these factors and agreed upon by the patient, pharmacists will work hard to make sure that you understand what to expect from these treatments. And they can also go along and help you set your treatment goals as well. Pharmacists may help you anticipate any negative or potential negative consequences of using the medication. What's really important is trying to understand how to recognize when those things occur, and then understanding, next of all, what they mean, whether there's something that's dangerous or something that's benign, something, for instance, that's only going to be an irritant, Or on the other hand, if it's a type of side effect that's going to be fleeting and pass quickly as long as you continue treatment, or something that would remain if the treatment continues. As anyone in the trades here knows, a tool is only effective as the skilled person who uses it. And pharmacists work very hard to make sure that you get the skills necessary to use the medication therapy effectively. Pharmacists are there to answer your questions, both before you decide to use a treatment, as well as after you begin the treatment and while you're on the treatments as well. Pharmacists can help you with monitoring the therapy as well, to make you understand whether or not your medications are actually helping you achieve those goals that you have set for your condition, and if there's any value in changing your therapy plan as well. If therapy plan changes are required, pharmacists can help guide those as well based upon what you teach them and then what they bring from their expertise based upon that. Even after finding a medication treatment that works for you, pharmacists are going to work hard to ensure that a medication that you might get put on later as well doesn't interfere with an existing set of treatments like your pain treatment. A wide variety of treatment options are available for those people who live with chronic pain. For most people to well manage their chronic pain, there's going to be probably more than one option, in fact, used to be successful. Most times, medication ends up being one of those options, no doubt about it. And from the show of hands when Dr. Toth spoke, obviously that's the case. However, medications alone are rarely going to be successful. And that's because medications may help reduce your pains. On the other hand, they have no ability to eliminate it or cure it completely. Goal of medication therapy for chronic pain is to reduce that type of pain that you have to a level which is considered tolerable. Tolerable pain might be best described for you as a pain that doesn't deeply affect the functions that you want to have on a daily basis. With medication therapy intact at appropriate levels, you may still describe that you feel pain. You may still know that you have a chronic pain condition. On the other hand, it should be reduced enough for you to still be able to enjoy things like reading a book, writing an email, putting the dishes away, exercising, and even getting adequate sleep. There are hundreds of medications that are used for chronic pain. People generally recognize some of the categories that are used. There's the over-the-counter analgesics that you buy without a doctor's prescription, a variety of different anti-inflammatories, the opiates, corticosteroids, even anesthetics are possible as well. Less commonly recognized, though, are a whole other class of medications which pain isn't their primary use, or maybe originally wasn't their primary use, but they're now being used to help modulate the amount of pain you experience. Those medications, for instance, are your muscle relaxants, your anticonvulsant medications, your antidepressants, and of course bone strengtheners as well. Finding a medication or a combination of medications that work for you is usually a bit of a trial. It's important that you understand that it's going to require your participation, your patience, and also your persistence in getting there. It's not uncommon that a medication that works fantastic for you for your pain condition might not work so well for you, and it might not allow you to reach your desired pain goals. Lots of tools are available out there to help you understand whether or not your medications are working. Dr. Toth spoke about some of those already. However, probably one of the best tools to understand whether your medications are working properly, thank you, I've got one here, is your opinion. There's nothing more important than sharing what your experience is with your pain. So that's a really important part of that you can play on the pain care team specifically. As you trial medications, you should be paying very close attention on how it's changing your experience of your pain, how it's changing your ability to function with that pain, and whether or not you're having any negative experiences that maybe or maybe not are attributable to the medications specifically themselves. If you keep a record of this yourself and bring it to each pain care meeting, you may be better educating your team, and that may allow them to make better treatment decisions for you. In other words, you really need to become a strong participant and an advocate for your own pain team, for that pain team to be successful. As for how a pain care team is created, well, there's all kinds of different ways a pain care team is created. It would be nice if they simply appeared as the need appeared as well, out of thin air. However, this is not the way it generally happens. I think for the best success is for someone like yourself, the person living with chronic pain, to look at the various people that you trust in your life to help you along with that journey. Next, you should actually choose to ask that person. Ask your family physician, ask your pharmacist, ask other healthcare professionals that you know are trustworthy and knowledgeable and willing to help. Perhaps asking your pharmacist to participate with you and your family physician as part of a pain care team may be that first step. During the initial discussion with your pharmacist, prepare them by explaining to them what you know about your current chronic pain condition. Also, your other medical conditions that you have. A little bit about your diet's very important. And everything, absolutely everything that you're on and using. That might include things such as your prescription medicines, over-the-counter treatments, your natural products, your herbal medications, your vitamins, even your nutritional supplements. This type of information is a powerful tool for the pharmacist to use to help you. Then stick to one pharmacy to supply all your medication needs from that point forward. This strengthens the communications that you have with your pharmacist on team to make sure that they understand about any changes to existing treatments that you currently have or any new pain treatments that you might be going through as well. It also makes sure that they have a complete medical record for any time that you want to speak to them about your condition. Your pharmacist needs to be very well informed, of course, but so does the whole pain care team, especially the physicians that you're working with. A great way for you to do this is by keeping your own record that includes things such as your own medical conditions, your pain diagnosis, a full list of everything that you're on as far in the way of the medications, and your other health information. I'd like everyone to attention be brought to the Knowledge is the Best Medication pamphlet that's inside of your kits here today. The outside portion you'll see, quite a bit bigger. It's a guide on how to use the inner portion, which is a medication record book. I want to tell you a little bit about this. The medication record book has several areas that are going to be important for you in order to be able to keep your own record and involve what you know with your care team. Number one, some personal information, including your emergency contacts. Page 2, personal information, including other people that are involved in your pain care team. Third page, the allergies to medications that you previously had. I'd encourage any intolerances to be listed there as well. Next page is all the different conditions that you might be treated for. There's a checkbox for some of the more obvious ones, but of course people have other ones beyond that. Write those out. Any previous hospitalizations or surgeries you've had in the past. A little bit about your family's medical history, in case that might be relevant to the future. Medical devices. I don't recognize any there really playing into pain, but I'd suggest that there's a lot of mobility issues sometimes involved with pain, and this is where you can list some of those mobility devices as well. And then finally, the medication record itself, giving things like the name of the medication, the dosage and instruction, reason you're taking it, who prescribed it, the date that it started, and if it ever was discontinued, you can also include there the date that it was discontinued. This might be one of the very first things you do to be part of your pain care team. And I want you to take the opportunity in the next 24 hours after leaving here today to fill that out. The more that you put there, the more powerful of a tool it can be in your treatment of chronic pain as well. You'll always want to have this record with you from that point on. Not only just in case of emergency visits to the emergency room or being picked up by an ambulance, so that it contains a lot of information they might need to treat you, but maybe even more importantly, to have it each meeting that you have with a member of your pain care team. That way, you'll be able to both share some information that's already existing in that, as well as you'll be able to update any information that comes as after a decision is made between you and your member of the healthcare or pain care team. One of the most important and necessary steps that you need to take to begin supporting your pain care team is to be part of that pain care team by keeping a very sound record about yourself. By doing this, you'll be well on your way from simply trying to manage your pain to actually living well with your pain care team. Thank you for the opportunity to speak today.